will give you some brief information about the conference as such, and then Dr. Dalla Favera and Dr. Friedberg will briefly summarize. Dr. Dalla Favera, the most outstanding data which were presented concerning basic research, laboratory research, and Dr. Friedberg will do the same for clinical data. Since tomorrow he is going to summarize the whole conference with the take-home messages at the end of the conference. So this is the 13th edition of the International Conference on Malignant Lymphoma from Lugano, which started the first time in 1981. The first time we were about 250 people. This time, overall, including free registration, invited people, and people who are cooperating with the conference, we are somewhere between 3,600 and 3,700. And considering also the fact that we have tried during the last weeks to somehow block the registrations because we were worried that we would have too many logistic problems. I guess that overall we didn't have, we had some, but minors, also because we were helped by the good weather. The good weather is always helping, because at least a few of the participants, although the majority, the vast majorities, are so lymphomaniacs that they stay into the room from 7:30 in the morning till 7:30 at night, but a few are still going out. So, I mean, from, although there is still 24 hours to go, but from a pure organizational point of view, besides a few minor problems, we are very satisfied. I think that what we can say also is that what we are hearing from the participants is that the participants are very glad. We had a lot of enthusiastic comments about the quality of the conference, about the lot of interactions which are possible during this conference. In fact, we try to have a very large spectrum of presentations, going from the clinical case discussions, epidemiology, to clinical trials, to basic research, translational research. And I think that what we have always tried to do is to insist very much on the fact that this should not become just a pure clinical conference, but that basic research and translational research should have an important part. So, for instance, yesterday morning and this morning, we reserved the biggest room for the presentation of data on biology of the tumors, although we knew that the majority of the participants would rather prefer to go to the clinical case discussions. And but we think that it is essential to keep a correct mixture of everything, and not to become just a pure clinical conference. We are already planning for the conference in 2 years from now. We will have some overall logistic improvement, in the sense that Lugano will become more easily reachable, because at that time we should have the direct connection, the direct train connection to Malpensa. We will have the high-speed train to Zurich. We are making a lot of publicity in order to have either a complete reshaping of this Congress Center or a new one. This will not have happened within the next 2 years, but perhaps we will find some solution with the new big cultural center of Lugano, that we can combine something, or we are also thinking of a few other possible logistic solutions. We tried this time, knowing that so many people would come, that to broadcast the main session not only here and in the tent, in the marquee, but also at 2 rooms in the university. But not too many people went there, so this is too far away. So we will have to find, if nothing else is happening, we will have to find a new solution, perhaps taking out the posters from the tent and having there a second overflow area or something like that, and putting the poster perhaps in the Villa Gianni, which is now has been renovated, and there is one floor, the last floor, where we did not as yet have the climatization, but will be the next time the climatization, so we could put the poster session there. And okay, so that's from my now non-scientific point of view, a non-scientific report, and now I would like to ask first Ricardo to briefly talk a little bit about the